Good evening. Welcome to the Spiritual But Not Religious Show. I'm your host, George Lewis. We've got a great show lined up, and actually we've been working through Mercury and retrograde all day, and I'll tell you what, it has been on top of our head. I've had two brand new computers that decided to not cooperate today, so we're using one of our old backup computers, and hopefully we're going to be able to give you the kind of quality that we would like to. I think that even if the quality's not great, my guest tonight will help make up for that. He does some really interesting kind of work. I want to tell you a little bit about next week's guest, my next week's guest is closely connected with Dr. Chikly. We have Dr. Bruno Chikly on this evening, and it's his wife, Alea Chikly, who's going to be on. Alea, after spending many years in Asia and in some of the very exotic kinds of spiritual sites, monasteries, and so forth, has developed a regression kind of therapy that's very, very unique, different from anything that I had ever seen or experienced. And my experience with it was absolutely positive. I was gifted a workshop with her at they were in the mountains up in Georgia, right at the base of the Appalachian Trail, and I was right at the tail end of cancer treatment for radiation and chemotherapy, and I was just finished up with surgery, or headed into surgery, and I had a weekend, a 3-day retreat up there with heart-centered therapy, and it just was wonderful, positive experience. Some really good friends had gifted me that weekend, and so I met Bruno and Alea then, and I think it was the spring of 2006 is when that happened. Let me tell you a bit about, before I talk about Bruno this evening, I want to talk a little bit about the Spiritual Broadcasting Network in this show, Spiritual But Not Religious. They're very much interconnected. I am convinced that there is a spiritual transformation in process that has been going on for a long time, but there's a quickening. It's starting to really happen very quickly, and we're participating in that. You know, there are really, I think at this point, millions of people who call themselves spiritual but not religious, who are either non-denominational or, like taking pieces of this belief and that belief, and they found their own kind of inner belief, very much God-centered kind of thing, God by whatever name they call it. But yet we don't have that community. We have all these diverse voices that, basically are very closely related in what we're looking for as an end result, and that's a transformation into the love vibration as opposed to the dark vibration that the world has been in all this time. And so the Spiritual Broadcasting Network will be bringing you those many diverse voices. And if I can get Tom to shut off the overhead light, we'll be much better, and we'll be ready to go. Yeah, it's on that back wall there, Tom. And when Tom gets back, we'll get Dr. Chikly online. He is the author of a book called Silent Waves. It's a theory and practice of lymph drainage therapy. That book is carried by the University Medical Library at Stanford, and the reviews on it are really fantastic. You're probably familiar with Dr. Bernie Siegel, who wrote, he's a best-selling author of Love, Medicine, and Miracles, and Peace, Love, and Healing, and How to Live Between Office Visits. And he says that this book is an incredible resource for patients, their caregivers, and health professionals. The extent of the information you make available to therapists and physicians is a gift we can all utilize in our practice and in our healing. So, Tom, if Tom's got Dr. Chikly on the line, we will chat. Bruno, if I got you there, are you able to hear me? Bruno?
Hello?
Are you there?
Yes.
Good. And you know what? You're coming through wonderfully. We have good audio. and
Perfect.
and Tom's getting me to move over so that your video is available and we can see it. It's actually, after all that's gone on today, we're really looking pretty good here.
Congratulations.
Yeah,
You're an offer.
I'm glad you're here. I'm really looking forward to our conversation. We started this what was it, a month ago or something, and we just had really difficult times, but somehow or other we weathered all that. You know, in the scheme of things, that kind of trouble isn't much, is it?
No, I mean, I have no problem. It just went at the right time. We were already very tired. We were going for Europe the next day. Don't worry. It was just the way it's supposed to be.
It worked out the way it was supposed to then.
Yeah, yeah.
So you actually not only have you written a book, but you've got an institute that. How long's your institute been? How long have you had that established?
We started almost 6 months ago. Believe it or not, it's very recent. But we taught the same kind of classes for 16 years now. About.
Right, you were with another institute at that.
Right, and we had about almost 8 to 10,000 students. It was a huge work we developed, and we're really happy we could help expand, give better health to North America and some classes in Europe.
Tom, we're getting just a little. Tom's gonna straighten out. We got a little kind of echo or whatever going on. So, with your institute, what do you actually do there? Is the institute really for just professionals, or is it for lay people? What?
Well, it's for anyone who could do manual therapy. And so we have a lot of PT, OT, osteopaths, a lot of manual massage therapists and nurses and acupuncturists, physicians, everybody who are interested to touch life with their hands and improve someone else's condition in a safe and non-invasive manner.
So you have a pretty nice acronym for it's the Chikly Health Institute, or CHI. That's very, very, very apropos. So, but what's different about your curriculum? What sets you apart from the other manual work?
Well, we are all building on the shoulders of the people before us. I'm just very creative, and I have a lot of education, and I have ability to go from the left brain to the right brain. So I am an MD, an osteopath. I have 3 doctorate, and I am also very intuitive, and I'm able to talk with my hands to the tissues and find the best way to resolve some challenge in the body, what they need to find some kind of healing. And so what we do is we develop, first of all, the lymph, and that was the first time, I think, in the world when we could work very specifically with the lymph rhythm and the lymph direction. So everybody came, because everybody was doing a lot of very basic lymphatic drainage or lymphatic techniques. They were like, a lot of people they said they were milking like a cow. They were just pumping all day long with no feedback. And when I introduced the way we can really feel the wave of the lymph, and just like surf on the waves, you can just go and feel the waves and go with it and check its rhythm, its direction, its quality, its depth. And then you begin to really have a discussion and interaction of feedback from the body, and you can just be a partner. You can now participate in the process of life and feel if what you're doing is okay, if you are going in the right direction or wrong, and etc. Yeah.
Well, you know what I think what we probably should do, Bruno, is I'm sure we have many viewers who really don't understand what we're, like what the lymph system is, what we're talking about at all. Can you give a layman's definition of what the purpose of the work is? What are we really trying to accomplish, and kind of generally how we approach that?
Right. So the bigger picture here is manual therapy. So I'm going to go from very wide to very small. Manual therapy is we have a pioneer in America, which is A.T. Steele, the father of osteopathy.
Uh-huh.
And the father of osteopathy basically influenced the manual therapy from PT, OT, from chiropractor, from Rolfing, all that, fascia therapy, all those are branches from the idea that there is some mechanism in the body to heal. There is sometimes it used to call the inner pharmacy of the body. We can release something and let the body heal itself with its own intrinsic forces. And then what we do now, we have to find what part of the body is off. And we have to know if it's the bones, and then we can work with the joints, the articulation,
right,
or inside the bones itself, or it's the arteries, the veins, if it could be the fascia, the muscle, and sometimes it's a lymph system. So the lymph system, and the other curriculum, by the way, is the brain. We'll talk about the brain after that. But the lymph system is the first one I introduced in the States. It was not that known. I think I wrote the very first book in North America. And
well, you had your education, I believe, in French University, and you got some kind of an honorable award or medal, or I don't recall.
Yeah, I did my. I was interested in manual therapy since the age of 12. And
really?
I did
Wow.
my medical thesis on the lymphatic system, and I got an award from the University of Paris with this thesis. And then there was a base for my book. The book is about 450 pages, and it was the first book in North America to really have an extensive discussion about the lymph system. And it's funny, you have to wait for a French guy to come and write a book about that. But everybody's talking about the lymph system for 20, 30 years, but nobody really put together and tried to understand. So when you ask a question about the lymph system, most physicians in the States, most PT, have a very basic education, and it's not very spread out, the exact function of the lymph system. So if you want, it's a second circulation. It's a parallel to the veins. It brings things from the tissue back to the heart. It brings toxins, heavy metals. In the lymph system, you don't have much oxygen, but you bring back something from the tissue to the heart. The question is, why do we need two pathways?
Right.
Why do we need the veins to bring back things from the tissue and the lymphatics? And they have two different functions. The veins are very fast and very efficient and bring a lot of things back to the heart. But if something is a little far inside the tissue, a little bit away from a vein, blood capillary, if something is stuck in the tissue, and especially if it's a little thick, if there's a mucus or there's inflammation, it's much harder to bring that through the vein. The vein is very fluid.
Right.
The lymph system is very slow, but it's like really taking the time to get rid of something that's very sticky, very rubbery in the tissue. You have that if you have when you have a cold, you have a mucus in your nose. You have the same thing in chronic fatigue syndrome, fibromyalgia. You will have something in your small intestine with digestion problem, with leaky gut syndrome. All those are very sticky fluid in the body, and the veins are moving something very fluid. It's very hard to move that out of the tissue. So the lymphatic system has intrinsic little muscles, motoricity, little pacemaker cells that contract and create what we call a peristalsis, a movement that actively is going to take things from the tissue and move it out of the tissue compartment, extracellular fluid. And this job cannot be done by the vein. And if the lymphatic were not working, some physiologists estimate we would die in maybe 48 hours,
wow,
or a little bit more, by auto-intoxication and maybe massive edema. And it's a system that moves so many things and so subtle. What I say to my students is, if you want to get a Nobel Prize, try to work with hormones in the lymphatic system, because we know in animals they are responsible for the state of heat. When the animals are on heat, menopause, osteoporosis, a lot of
Really?
things we don't know. Yeah, and we don't study that too much in humans, and there's a lot of unknown functions. It's very subtle. Even with your hand, it's very subtle to feel. It's connected with your emotional state. It's like little lakes and little rivers. And in our society, the water element is not very recognized. It's just something very feminine, very light, and people don't pay attention to something so sweet and gentle. But it's very, very important. Actually, Alexis Carrel got a Nobel Prize, made a mistake in the experiment, but thought that if you clear the lymph system all the time, you would almost be immortal. And he
Wow.
made a mistake on his experiment, but he thought he could make the cells of the embryo of the heart of a chicken live forever almost with his, the way he was cleaning them.
Well, you know, the
Anyway,
first time I heard anything about the lymph system, Bruno, was about cancer getting in the lymph nodes.
Right.
So-
That is what we do learn in our medical education. We learn about cancer, metastasis. We learn about immune system.
Right.
We never had the stand. I never learned, and we're very good education in Europe. I never learned that well the extensive network of vessels going throughout the whole body, how beautiful they are, how gentle they move, low velocity, beautiful transparent fluid, thin little vessel like angel hairs. It's something very beautiful to feel, and even when we do dissection, it's hard to see, but it's a very subtle system. But we know about cancer, and what we know is that some cancer are in the lymph system, they are the lymphomas,
Right.
and some cancer have the tendency to spread through the lymph system, and those are breast, thyroid, lung, liver, skin, prostate. Some of those have more of a tendency to go through the lymph system than the blood system. They do both, but you have to remember that the lymphatic system is a natural system, and you also have a lot of cancer cells every day in your system. You know that, right, George?
Right.
You have a lot of cancer cells. And the problem is to be able to destroy enough of it.
Right.
If you have, I forget, maybe 3%, if you have less than 3 to 5%, you can probably destroy them with your natural defenses. If you have more, then you are overwhelmed and the system cannot get rid of them, and you develop cancer. But they are spread through the lymph and through the blood all along our life. It's a natural pathway to eliminate those cells.
Well, you know what's curious to me, Bruno, is that as important as I'm coming to understand the lymph system is, and you know, in looking at your work and what you accomplish with it, it's really it's curious that the medical profession hasn't done more with this. What is it that sets it outside of, I don't know, is mainstream the right word, or what sets it outside of?
Well, it's a very good question. It's totally appropriate. You know, the venous system is important, right? The veins are something, but in history we start with cardiovascular, so we do a lot of arteries. The specialty called phlebology for the veins, I think you have the same words in English,
Right.
came very late. And recently we have lymphology. Why? Because you can cut a lymph vessel. You're not going to die right away. So you know, people, and it was discovered very late in history. It was discovered in 1622. We discovered the presence of the lymph system in the body in Italy. But in 1624, 26, we had Harvey, who discovered not the existence, but the real functioning of the heart and the circulation of the heart. That was discovered. The physiology, the function of the blood system was discovered about the same time that we discovered the mere presence of the lymph system. It came very late, very hard to understand its immune functions. It's very subtle, and when you do dissection, you need to inject a dye. You don't see the lymphatic as easily unless you inject a dye or inject it unless it's in the abdomen. But usually you don't see them, and so it's hard to study.
Okay, that makes sense. How does, excuse me, I got something in the air here. How do you connect the lymph system with your brain work? What's the connection there?
Well, Actually, there are two different separate curriculum.
Okay.
The lymph system, I begin to really push the envelope because people was really working on the muscle, on the skin. I begin to develop some technique for all the viscera, the spleen, the prostate, the lung, the thyroid, and I begin to work with the meninges, the envelope of the brain. We have three meninges, and there is lymph system, there is lymph vessels in the dura mater and the pia mater. And I begin to work on those layers, and then I begin to naturally enter to the amazing kingdom of the brain and consciousness. And I begin to have amazing results, and I couldn't believe what I did, and I begin to spread it, and I begin to teach it, and I have, every school, a lot of osteopathic school in Europe, and a lot of people ask me to know about this brain. It's another breakthrough in terms of manual therapy, a place when we never wanted to go. I mean, we didn't know how to go through the skull into the brain tissue with our hands, and it's a question people ask how we work on the brain, but with experience, we develop a touch to feel the lymph and then to feel the viscera, and you can feel, even if you feel a bone, you never feel the bone directly. You feel a bone through the muscle, through the skin, through the fascia.
Right.
But then you develop, with your hand, you can separate and say, well, this is duodenum, this is pancreas, this is gallbladder, and eventually you develop that through the ribs. And you can say, well, I have the lungs, the fissure of the lung, I have the heart, I have the cavity of the heart, the valve of the heart, through the thorax, and eventually with advanced training, you can feel different consistency, density, reaction in the brain itself. So it's for advanced practitioner, but the results are amazing because the brain is really a core element, a primary problem that can release things all the way to your toes, because your brain, spinal cord, the spinal and cranial nerve, going all the way to the endings of the skin, will influence everything in your body.
So let me see if I've got the right visual. The work that you do, the touch work with this, you're touching the skull and feeling the brain, and you're able to feel the other organs at that point, or are you in the body?
No, it's totally different. We train about, I forget, 500 practitioners or maybe a little more to feel the central nervous system, the tissue of the central nervous system, which is the first level is more the brain. Level 2 we go more in spinal cord.
Okay.
Level 3 we go more in the nerve and the autonomic nervous system. ANS, autonomic nervous system, and so they feel that, but those nerves are going to influence muscles, arteries, veins, fascia, viscera, joints, and the reaction will be throughout the whole body and pretty dramatic. I learned a lot of system when I arrived to the brain. It was no man's land practically, and to go in that detail and release that much is still really spectacular for me. And it's so non-invasive. I use the brain every single day. It's something that is very important to have as a tool to release problems in the body. Lower back, shoulder problem, eye problem, to headaches, epilepsy, cognitive function, ADD, anything like that, memory problem.
So you trace the source of all these things back to the brain, and then you make the cure from there out, is what I'm hearing.
Yeah, I'll give you an example. For example, the low back problem.
Right.
There's a lot of different cases. There's a lot of things that rotate here and there, but very, very common. You have a brain that has been affected by birth, by trauma. Car accident is very common, by toxicity. You could work in a factory with toxicity. You could be intoxicated by chemical products. You used to develop your own photos or smells. Your mother used to smoke when you were pregnant, and you get nicotine or anything like that will affect the brain. The brain is going to be going the wrong, rotating, side bending. We say is going to be located in the wrong place in your skull. And very often you go anterior on the side, and by doing that, it will pull with it the spinal cord. The spinal cord is attached to the sacrum by what we call the filum terminale, going to pull the sacrum, lock it in a position, and then you're going to do a movement, and your lumbar are going to be inflamed. You're going to have a disc because there's no space anymore to compensate. The sacrum is stuck up, and you cannot compensate. So people.
Well, let me just stop you for just 1 second. Tell us about the sacrum, so that our viewers will understand.
The sacrum bone. Yeah, the sacrum is that the triangular bone at the bottom of your lumbar.
Uh-huh.
So this bone just above your what we call the gluteal fold, and we call that the crack.
Uh-huh. Okay.
But it's just around there.
The crack in consciousness? No.
What do you say?
I say the crack in consciousness. I was making a poor joke here, Bruno.
So
the sacrum is. So the sacrum is
so
really.
The sacrum is right there, and it's like a fusion of it's 5 vertebrae that are fused that continue the spine, the lumbar spine.
Uh-huh.
The lumbar spine is what you have in the curve of your back, and this is going to pull up eventually, pulled up by the brain all the way up, and compress your lumbar.
Wow.
So you go to an exam and you do have problem with your disc and you do have compression, but that is just something often come from the top. So I have all those complicated cases that nobody can heal, that have that problem. They have to go to surgery. Sometimes they give me 2 days. This is, if you don't fix it, 2 days I go to surgery. And, sometimes it's the brain. And very often I realize that if I release the brain, put it back in place, relax the tension all the way to the spinal cord, the sacrum drop, the disc have more space between the lumbar, and often that's all it takes to release back pain. And so we need to do more study to be more, to be able to affirm that more positively. But it's very common for me to help these people this way. And also, this is a little bit the same kind of case in what we call tethered cord. The tethered cord is also some symptom some syndrome when you have, sometimes they think maybe scoliosis. It's the same case when the spinal cord is pulled up.
Uh-huh.
And so there's a lot of things showing that kind of case, but the brain will pull, it will pull. I don't know if you've seen on the picture. Look, if you can see my shirt, it's going to pull everything. And
Right.
they have frozen shoulder to carpal tunnel syndrome to any kind of restriction anywhere is going to pull on one side through the spinal nerve and cranial nerve, going all the way to the periphery, through the receptors at the end. They will grab the tissue like claws and bring everything in tension. And you're going to release those tension through the brain and through the autonomic nervous system, that is the sympathetic system, especially bring a tone and bring the muscle into hypertone. Too much tone in the muscle and the fascia. All those tension are usually created by the sympathetic system, the fight or flight system, that is controlled partly by the brain.
Uh-huh. So the sacral work that we're talking about in that,
right?
Has that suffered the way that chiropractic suffered in its early days? That it wasn't really accepted by the mainstream medical community, or
not exactly. But all that is, manual therapy. It takes a lot of time and money to do tests, and we're trying to do tests on soldiers. Now we may talk about it later. It's very hard to have an institutional review board, IRB, to be approved by. You need to have a college and a school behind you. So the manual therapy doesn't have a lot of acceptance. I mean, there's a lot of study out there, but nothing compared to other more medical, more
right.
objective. With PLs, it's pretty objective. So we have a lot of things. The first work they used on the sacrum was more on the bones. Now we're talking about inside, what's pulling the bone, the envelope around the brain, and inside that you have the brain tissue itself that control through their influx of neurons, the nerve conduction will influence all the tissue and all the tone in your body. And so it's another layer of control. It's not just putting on the bone and the joints. Now we're talking about the noble brain tissue, the noble tissue of the central nervous system.
When you say noble tissue, break that down. Help us to understand that.
Yeah, well, actually, that was a quote, I think, from A.T. Steele, again, the father of osteopathy.
Uh-huh.
He said this, the cerebrospinal fluid, is one of the most noble fluids in the body. The
Okay.
brain is a noble tissue. You know, you have to. The body will go very far to protect the brain before all. It will keep bringing you oxygen and blood and water
okay.
in the brain for the longest time because it protects it before any other thing. And when you touch the brain, you do it with utmost respect. It's not like you're working on the bone and you try to manipulate the bone. You really try not to manipulate the brain. It's consciousness. It's a bridge between physical and non-physical. There's a physical tissue with a very specific anatomy, but you have also chemicals, you have emotions, you have neuropeptides. The neuropeptides is what's going to give you emotion there. You're going to have, so when you touch it, you dance with it, you listen to it, you facilitate its own, so much wisdom, and you can say almost sacredness. When you go there, you can imagine the brain is a holy of holy for the body. It's something, the heart too, but it's something that is very aware and very conscious, and you want to touch this brain with a lot of support, openness, and care. So in that sense, I call that a noble tissue.
I understand. How do you believe that the brain connects consciousness? How what's the?
That's a very complicated question.
Yes.
We know on different levels. We know that, for example, in psychology, if you want to change, how come we have psychosomatic disease going from the body to the emotion? The neuropeptides and the peptides, in general, the hormones, are a place when if you change your emotion, your thoughts, you're going to change your peptides.
Absolutely, yes. Much changes at that point, doesn't it?
Right, and you change your peptides, you're going to change your tissue. So you have here a link between somatic and emotion, because the peptide is something physical. It's a physical part, and it may even change around the DNA, what we call the histones, and may change the DNA, the genetic material. So here you have a link. The peptide is something that, at that level, we know is consciousness, and you're really like here an interface between consciousness and non-consciousness. On a cellular level, on the very microscopic level, there's little microtubules. Some people think that you have some light going through those tubules that may help process consciousness, but it's very, consciousness, we don't even know what's located in the body. For example, some, you take what's an amoeba, a very basic animal, amoeba. Yeah. Well, they don't have a nervous system, but we know that they can avoid obstacles. They can decide to go left or right. They can do, without eyes and without feedback from the nervous system, they can do a lot of things that seems to imply consciousness.
Uh-huh.
And actually, there's even theory that the consciousness could be outside of it, in what they call the zero-point field. I don't know if you're the quantic theory, you probably know the zero-point field. So, either inside, either outside, that we just are tuning, vibrating with the consciousness inside. This is, I think, I'm not mastering yet the answer to that question, but what you know is when you touch the brain, you feel so honored, you feel so supported, and you have to work with consciousness. You're not moving a brain like you just try to manipulate something in your body or move a table. You don't do that. You really participate and support the brain. George, any cells in the body, I say that often, has 100,000 metabolic functions per second.
Per second.
100,000 functions per cell per second.
Wow.
And then how can you think with your hand you really understand what's going on there and going to come here and say, I'm going to have an agenda and say, I'm going to do this. It's really a way to attune to what's happening with great respect and be invited as an honored guest and to support the system to go where it wants to go. And to help it, if it gives you feedback, how it wants you to help it. And hopefully you are less invasive, and basically I'm trying to find the most gentle, non-invasive techniques.
You know,
to have
Bruno,
the most efficiency, that have the most efficiency.
you know, there's one thing that's standing out very, very much in this conversation, and I'm sure anybody who's listening is feeling that, and that is your when you get into talking about this as being noble and your kindness with it. I think everybody I know would love to have a doctor who operated from that level, who felt that way. That's very, very powerful.
I've been trained as an MD, but I didn't want to work as a regular MD for that because, we're blocked into training for 6 to 8 minutes. We are blocked to just write a prescription and not connect with anything. The reason for the problem, physical, emotional, even spiritual, we just pick things and it's not interesting as much for me, but touching life and understanding principle make me grow, make them grow, and it's also a matter of my heart. I love touching the body tissue. I love touching the brain, and the brain knows it. And I tell my students, this is my trick. I love touching the cells. I love feeling it's like a baby crying. I go there, what's your problem? And I try to help it, and they feel good again, and they're fine, and the healing happens. And that's what I do. It's this love, and this is where I am a little bit different from my education. I try to integrate my left and right brain. I try to integrate my scientist and my humanity. I try to be masculine and feminine, and to have this quality of heart with the tissue, especially to really try to connect with that, to be open to whatever is there, even spiritual moments in the room during a session. I try to be open to what is in life process, and I know as a scientist that at this point we cannot see on a machine a heart.
Right.
You cannot. I love my wife, and they're going to come and say, no, you cannot love your wife. I say, why? Well, because you can prove it. Well, I can't prove it, but there's things we cannot prove yet. Doesn't mean they don't exist. It means that we don't have the machine, we don't have the different principles, we don't have the theory behind it, but they will stop you from doing anything, and I don't like that. A good scientist should say, I stay open to it until I can prove it one way or the other. A lot of scientists do something else. They just say, no, it doesn't exist because I cannot prove it. It's not the right way. The right way should be to say, I cannot prove it, so I don't know if it exists or not. But I'm not going to go against you if you want to love your wife.
That's a good deal of openness, but we're not all very open, are we? The integration that you were just talking about with your masculine and your feminine and your scientist, your right and left brain, I think that's hugely important on our spiritual journey, that we begin to integrate these aspects of ourselves. We tend to compartmentalize them, and I think that makes us much smaller as people and as consciousness.
Yeah, you're right. I mean, I can't say I am a physician and I come to you like that and look how it feels to you. I mean, if I say I'm a physician, come and lay down on my table. And there's nothing wrong about that.
Right.
But I am also I'm a husband, I am a teacher, I am a creator, I am an author, I am a brother, I am. So who am I? When I present myself, I try to be the most open because I also am a spiritual being. It just happened that if you hear me talking like that, it's because I have a lot of spiritual experience, spontaneous experience when I was 5 years old, and I saw something bigger than just my limited being, and there's something bigger outside of me, and there is a unified field outside. So when I enter with a client, I try to connect with that unified field beyond my mask and my name and my compartmentalization, because it's not I'm going to miss a lot of what's happening. I have an event of life in front of me. I don't have, it's something happening, something has been disturbed. I try to stay open and try it on every level. And this is the difficulty, is to multi-layer my touch. When I touch, I feel the physical and all the anatomy. It takes years to learn the emotion behind it, the chemical reaction, the microscopic anatomy, the cells, and you feel the thoughts, the belief system. All that is in the tissue, and if you feel all that, you try to find the key. Which one of these layers are most disturbed and are the primary problem in that condition? So in order to do that, I have to be open to. My wife do a lot of emotional work, beautiful emotional work, and I think you have her on the program.
Right.
So I I have to be open to all those dimensions to find the problem. For example, imagine you are stressed and your shoulders are up and you are very stressed. And I'm trying to fight those shoulders for 10 sessions. They're never not going to go down until you talk to me and he says, you know what, I think I'm going to have a lawsuit, to have a divorce. And that is going to relax your shoulder. Then I will be able to do maybe a little bit of physical work on those shoulders. But the shoulders are not going to go down just physically if they don't want, if the key is not a physical problem.
Will you also incorporate a degree in psychology? If I'm not.
Yeah, I had a license in psychology, what they call in France a licensed psychology. I was fairly disappointed because we did learn statistic and experimental psychology, but it was a lot of Freud.
Right.
It was really the first wave of psychology, and I didn't understand they had the key. And really, I was really impressed by my wife, the way she's a, don't tell her I tell that, but she's basically an emotional genius. For me, she understood all those theories naturally. She's a natural. You know, she feels your emotion, my emotion, sometimes more than ourselves. She understands what it is to feel emotion, how they get disturbed, how to release them.
Well, she definitely is an emotional genius. I totally agree with you. Yeah.
Yeah.
Well, one of the things, Bruno, about you and what you say about your spirituality and everything you said, I really, I have this, because I know your wife Alea and I know the depth of her, I know that I believe that she could not be with you and in love with you if you didn't have this depth. And that's very, very, very powerful. I wish there was some way that this conversation would bring that to our viewers. But I think if they tune in next week and they have they hear my chat with Alea, they'll be able to put some things together here that'll make tonight an even more important night. You presented your work to the staff of the Walter Reed Military Hospital, didn't you? And you want to work on. Let's talk about that.
This brain work is very advanced, and we have a lot of practitioners, and we do that from our heart. I mean, we're therapists, but we do that to help people. I mean,
right.
So, and to spread health and well-being on any level we can. And so, what we were amazed is how fast we can cure a lot of the bomb blast, the syndrome that a lot of the soldiers from Iraq, they have when they come back. And some people, they get 12, 15 blasts, close, far away, and they come back home, they're young kids, and they can't function. They can't focus, they have no memory, they have headaches, they sleep all the time, they cannot sleep, they get angry, and it's just something for us very, very fairly easy usually to treat. It takes 2-3 sessions, and they are back to 80% of their function is back. They can now have a job.
Is that a physical thing because of the brain got tossed around so much in the blast, or is it psychological or both?
The blast affects a lot of the tissue, especially going through air. First of all, you have the first wave, which is the blast itself. Then you forget. Secondarily, you're going to hit something, and then you're going to hit something on your face. You're going to fall something in the jeep. You're going to hit something in the back, and sometimes there's something falling on you. So all that is happening, and the brain is twisted, and the fluid are stuck. The parenchyma, the brain tissue, has been affected, and it's fairly easy, to release a lot of those. Congress have a lot of money for that. It's 30% of the army. It's a whole next layer of our population that is going to be sometimes vegetable.
Absolutely.
They can't work. They have a problem with their relationship. And I said, wow, let me go to Walter Reed. And actually, one of the first soldier we treated was one of my students. She treated this soldier for I don't know how long before. She tried every kind of therapy she knew. She came for the brain level 1 once, and this soldier would not talk. He would enter the room, lay down, and leave after the session. She worked on him the first time. As soon as she came back home, the therapist, after taking brain 1, the soldier talked during the session, came back home, began to have conversation with his friends and with his family. And he was much, much better in the time. So I decided to present it to Walter Reed and to do a study with about 3 sessions. We bring some therapists, bring some soldiers, and treat them and see a before-after. And we have a neurologist, a really wonderful neurologist,
I'm sure.
We thought we were going to be ready last summer, but it took more time. And so we went to Walter Reed to present that, and we treated 3-4 soldiers there. They were really, we had the head of amputee, the head of we had a lot of PT there, and so they were excited. They said we need to do a pilot study to do 30 cases first. But to do that, we need an IRB, an approval from something, and we had one, and it was difficult. We're still working on it.
Yeah, that's the problem. Sometimes you wonder if the bureaucracy is really concerned.
Because basically, this is what. Imagine we have 30% of the army almost suffering from it. We have a solution that is non-invasive, that is fairly cheap. It's about 2-3 sessions, 4 sessions, fairly cheap, non-invasive, no side effects. Basically, very little side effects. Like the other little. Like after any massage, you feel a zombie for a few minutes, few hours, and you go back home or half an hour. Nothing else. And we are like, come on, guys, those soldiers are suffering. Can we help them? Can we put our name and can you send some soldiers to our therapist? And it takes a lot of time. The bureaucracy is, I didn't realize how difficult it is. George, if you discover tomorrow that, I don't know, eating a piece of paper will help something, and you treat thousands of cases, it takes you maybe 5 years, maybe sometimes 10 years to have enough protocol support, acceptance, to be able to develop your technique and to have enough cases to make a study that is valid. And then, it takes forever. It takes forever to really be accepted. And we're waiting with some frustration, trying to help the soldiers coming back from Iraq and Afghanistan. And so we get them here and there by word of mouth, but so I was trying to have some donation, because we will try to fly the soldiers in a place, pay maybe for the therapy. We have 3 scientists that are going to, one statistician that will do the statistics, is working or was working with NASA. So we have 3 professional researchers are helping us, and we are a little bit stuck, but we're going to try to find a way to change the protocol. It took us a lot of time to put that together.
In the meantime, Bruno, is there some way that I know there are just so most people are connected somehow or other with somebody who's had been in Iraq or having difficulty. What's the best way for them to contact somebody who does show up?
I think the best would be to go to our website. We're not ready now. It's going to take maybe a month and a half or maybe a little more to have. We have a tab on the homepage called Find a Therapist. Find a therapist for you, and you put your state and we don't have that ready right now. But if you go to the website, chiklyinstitute.org. So it's C like Charlie, H-I-K like kite, L like Lima, and Y like Yankee. Institute.org. You'll find or .com. We have all the websites. You'll find maybe in a month and a half a place where you can find therapists that can help. And you can read about what we're doing, and if you want to give a donation, you are welcome. But right now we are pretty much trying to help them. But the best is to have a soldier, one way or the other. The donation is really to put the study together. Then we can spread it. At some point we have the wife of the soldier. I thought she will receive some phone calls and give the name of our therapist away, but because we really helped her. But whatever is going to happen, I just leave it to the universe. We're ready. We have a lot of we have a solution basically to a national problem, an international problem, and when we'll be ready, we'll be ready with that.
Do you at all? I'm sorry. Do you at all connect? The work that you do with these soldiers with the emotional work that Alea does. Is there any?
Yes, but for the study, we will do the pilot study on the physical symptom, because it's much easier to get some kind of recognition and approval.
Yeah.
Absolutely. There's a lot of interaction. There's a lot of PTSD. There's a lot of emotional work. They absolutely need some emotional release. It's so important for them. But before even you get there, you have to understand they have headaches. They can't focus. They don't have memory. They cannot concentrate. They don't sleep, or they sleep too much, or they get depressed or angry or have visual problems. you have to fix them a little bit physically and make them a little more comfortable with their nervous system. Then they can get a job, get a good relationship with their wife, and then we can do the emotional part. When the physical is so, right there, we have to release that, and then we'll do the emotion. When they release some emotion, then we go back to the physical because we're going to readjust them a little bit. And so we have a lot of interface, a lot of physical session and emotional session. And all that is, as you said, it's spiritual because my physical is also spiritual. The emotional with Alaya, I forget it was next week. Yes, it's going to be emotional and spiritual.
Right.
You're going to feel our heart. So it's definitely integrated in everybody's life. Everybody's healing. You have a physical and emotional, mental part.
Okay, well, I'll tell you what, Bruno, it's been you're an interesting guy. I really have, I enjoy talking with you. I enjoyed meeting you when I met. I wanted to get, there were so many people around, I didn't get much time to get with you, but I wanted to talk with you, back a few years back. So it's a real pleasure for me to have you on this evening. We've got a couple of minutes left, and what I'd like to do is offer that couple of minutes to you. If you have something we haven't covered, something that's of real importance to you that you would like to say.
No, I think we covered a lot of bases. We tried to put together techniques to really help people out there, to tell them you can touch without being very clinical and cold, to touch your heart out there, to connect with them, to their tissue, to try to understand their problem and do something very gentle for them, for their tissue, and very efficient. And that's our path to be something. I'm trying to find the most efficient way and the most loving way to heal people without invading them, being very caring, very loving, with a lot of technique, but still a way that will help nature on its way and cover, appreciate, support, facilitate all aspects of the being as much as we can, even though it's very big. But when you get something in the office, someone is the result of his personal life, his lineage, his family lineage, and his whole family is behind him there, his DNA, his ancestors, and all these different layers of tissue, and we try to honor all that and try to see if we can help in any way.
Well, I'll tell you what, Bruno, you've got a great servant's heart. I appreciate you, and Tom has put your contact information up in the chat room, and he's been all the time we've been talking. He's been talking with people in the chat room and in the the various Facebook and Twitter places that we are at. So, and I'm going to work at getting this video together, and hopefully I'll be able to get it up on YouTube. And once I do that, I'll send you some links. Tell Leah I'm very much looking forward to talking to her next week, and I thank you for joining us tonight. Thank you, George. It was a great pleasure. Don't miss Alaya next week. She's the real deal. You may have a transforming moment with her. She is the real deal. That I know for sure. You have a good night, Bruno. Thank you. Thank you, George. Thank you. Good night now. Good night. And Tom's going to hang that up, and we'll be all set. Well, that the topic that we had tonight it's an intense topic. It's complex. It's complicated, and but it needs to be talked about. There's this, and you might wonder, well, why did we have this on a spiritual but not religious show? But there's this real connection with our spiritual and with our body, and if we don't honor that and get that working together, we can't make the kind of spiritual progress that we want to make. We just can't compartmentalize these various parts of us, like as Bruno was talking about with the right brain and the left brain. We have to somehow or other integrate those. They're all there for our use, for our spiritual path. So I hope you enjoyed tonight's show. Be sure and come back next week. You're going to love Alaya. She is, like Bruno said, the real deal. Be sure and come back. And in the meantime, don't forget to accentuate the positive and have a fantastic week.